exceeded thresholds in all three areas. The first area I'll talk about is elevated disease transmission. This has an or situation to it. So what that is if we have case rate of more than 100 per 100,000 population over the last 14 days, or if we have a case rate of more than 25 per 100,000 population, if our testing positivity rate is greater than 8%. Butte County exceeded the case rate of being over 100 cases per 100,000 population in the past 14 days. Our positivity test rate remains less than 8%, but it has been increasing. The second area is increasing hospitalizations. If the increase in COVID positive patients hospitalized within the county is more than 10% over a 3-day average, then we're considered to have been over the established threshold. And Butte County is over that 10% increase. And finally, the third area is limited hospital capacity. This has another or situation to it. So the threshold is established at less than 20% ICU bed capacity or 25%, less than 25% of ventilators are available. Butte County has exceeded the ICU bed capacity since ours is less than 20%. So what this means is that we have fewer than 20% of our total ICU beds available in the county that are open and available to new patients. Now, I would like to make it clear that this metric measures ICU bed use for all patients, not just COVID. So let me say that in another way to reiterate. The metric that the state shows is correct, but all of the patients in ICU beds are not COVID patients. Now, this doesn't mean that our hospitals are not impacted by COVID and our increasing rates. As we increase cases and as we have outbreaks, there are more likely to be patients that need to be hospitalized and more patients that need to go into ICU. Currently, I spoke to all CEOs of our 3 hospitals, and they are not concerned with a surge capacity. That could change, but as of right now, our hospitals are doing okay. So now that Butte County is on the monitoring list, the public can see these numbers on the chart that the state posts on their covid19.ca.gov website. We will also post a link to that chart on our buttecounty.net/public health website so people can link to it easily. So what does it mean to be on the monitoring list? That's the question of the day. So once added to the monitoring list, the clock starts ticking. If we remain on the list for 3 consecutive days, we are required to implement further restrictions as ordered by the state health officer. Tomorrow, which is Friday, July 24th, will be our 3rd day on the monitoring list. So that means starting Saturday, the following businesses, events, and activities must close all indoor activities. Those are gyms and fitness centers, places of worship, protest, offices for non-critical infrastructure sectors, personal care services including nail salons, massage parlors, and tattoo parlors, hair salons and barbershops, and malls. So a lot of people also want to know what does it take to get off the monitoring list. So all of those metrics that I mentioned before need to improve and be below the thresholds established in order for us to be removed from the list. However, there's not any specific number of the metrics that we need to get below. In other words, if our case rate goes down, but our ICU capacity does not go up, we have no guarantee of getting off the monitoring list. And further bad news, based on the state health officer order, if we get off the monitoring list, the sectors that had to close indoor operations do not automatically get to open those back up. So the state health officer has to revise her order before those operations can go back to indoor. However, with that said, other than making our community healthier, there is an incentive to getting off the monitoring list. In order for any of our schools to be able to offer in-person classes, the county has to be off the monitoring list for a minimum of 2 weeks. This applies to all K through 12 schools, whether they're public, private, or charter. No school may open in-person classes until Butte County is off the state's monitoring list for at least 2 weeks. Now, there may be an established waiver for process that elementary schools can go through, but that process has yet to be finalized and distributed. So in closing, please help keep Butte County healthy and allow our schools to have the opportunity to provide in-person classes if they choose, by doing everything we can to get off the list. In order to do that, we must slow the spread of COVID-19, and it is every community member's responsibility to help. Stay at home as much as possible and only go out when necessary. Wear your face coverings when around anyone outside of your household unit. Maintain at least 6 feet distance between yourself and anyone outside your household unit. And do not host or attend gatherings of any size. Thank you.
Good morning. I'm Corey Honey, Sheriff, Coroner of Butte County. Within the past 2 weeks, there has been a rapid increase in the number of lab-confirmed COVID-19 cases within the Butte County Jail. This increase coincides with an increase in the number of confirmed cases throughout Butte County and in many parts of California, including other correctional facilities throughout the state. The Butte County Sheriff's Office is working cooperatively with the Butte County Public Health Department and WellPath, the jail's medical service provider, to mitigate the spread of COVID-19 within the jail and provide appropriate care for those inmates currently infected with this illness. And I would just like to take a moment to thank Danette for the very strong support and collaborative effort that we have been able to engage in. We speak multiple times a day, most weeks, and work on issues. And I'd also like to thank our medical service provider, WellPath. They have been instrumental in helping us deal with this. Today, I'll provide an update about COVID-19 within the Butte County Jail and give details on the Butte County Sheriff's Office's efforts to mitigate the spread of the virus within our facility. To give you some context, it's important to understand the size of our jail. Our current population in the Butte County Jail is 476. By contrast, our population on March 1st of 2020, when this all started, was 569. So you can see that we have worked diligently to maintain the population of the jail at a level that helps us deal with capacity issues and accounts for our ability to isolate people who have this illness. To date, approximately 384 tests have been administered to inmates within the Butte County Jail. In some cases, the same inmate was administered more than one test to determine whether or not they were positive at a later date. 270 of those tests have come back negative. As of yesterday, 79 were positive, and 11 inmates have recovered. As we sit here today, 42 tests are pending, and that is due to our ongoing effort to provide surveillance and aggressive testing of inmates who are asymptomatic but who may have come into contact with someone who was tested positive. The overwhelming number of inmates with COVID-19 that are currently in the jail are asymptomatic or only have very mild symptoms and therefore do not require hospitalization. Since the beginning of the pandemic, there have been 2 inmates who were sent to the hospital primarily because they showed less than normal oxygen saturation levels with their blood. Both of them have been treated and released from the hospital and returned to custody at the Sheriff's Office, where they continue to be monitored by our medical staff. Inmates who have tested positive are in isolation, and they have their vital signs checked 2 times per day, once in the morning, once in the evening. 2 That consists of their pulse being checked, their oxygen saturation levels being checked, and their temperature being checked. They're also questioned by our medical staff as to determine whether or not they have symptoms and whether or not those symptoms are becoming increasing or becoming worse. Inmates who have been exposed but who have not yet tested positive are quarantined for up to 14 days. They have their vitals checked once a day, and that's the same process where their pulse is checked, their oxygen saturation levels are checked, and their temperatures are checked. The remainder of the inmate population has temperature and symptom checks weekly. What I mean by that is that medical staff go through the entire facility. They make contact with every single inmate. They check their temperature. They talk to them, and they try to determine whether or not they might be showing symptoms. These efforts meet or exceed the level of care that asymptomatic or mildly symptomatic patients would receive in the community. The fact is that asymptomatic or mildly symptomatic individuals who were in the community would very likely be required to stay home and check in with Butte County Public Health, but wouldn't have access to a nurse within minutes and wouldn't be checked, their vital signs being checked twice a day. And if Danette, if that's inaccurate? Okay. And Danette confirms that that's an accurate statement. In addition to these efforts, all of our inmates have been provided with cloth masks, very similar to the one that I am wearing. We are exchanging those masks with clean masks every 2 days, and we are highly encouraging inmates to wear their masks. Inmates who are 65 years of age or older, or inmates with respiratory issues, are being provided N95 masks, which provides a greater level of protection not only to them, but the people that they may encounter. Now I'd like to discuss the testing and monitoring of our staff members. Approximately 200 tests have been administered to staff members. Again, in some cases, they were duplicate. To date, one staff member has tested positive for COVID-19. The employee is currently in isolation and initially had mild symptoms, but those symptoms have now abated. I was on the phone with that employee just before this press conference to check on the status, and I'm happy to report that the employee is recovering and will hopefully be returning to work after his isolation period has concluded. Our effort to test staff who may have been exposed is ongoing, and that is again an ongoing effort to identify the spread of COVID in asymptomatic people and take the steps necessary to protect everyone. Our staff has also been equipped with proper PPE, personal protective equipment, and they are required to wear the PPE when interacting with inmates. As I've said in previous press conferences and previous press briefings, we are working very diligently to try to mitigate the risk of COVID-19 spreading within the facility. This is a daunting task, especially considering the fact that when you're dealing with asymptomatic people, it is very, very difficult to screen for that. To recap some of our efforts, beginning at the booking process, when a person is brought to the Butte County Jail, they are screened by our medical professionals to determine whether or not they are symptomatic or whether or not they have been exposed to COVID-19. If that is the case, they take precautions to isolate those individuals. We're also working to maintain the cleanliness of our facility. We have increased our efforts to clean. We've provided additional cleaning supplies. We've provided additional PPE, and we're working very diligently along with our medical providers to detect it and treat it and make sure that the inmates who have been exposed or the staff members have been exposed are getting the proper care that they need. Finally, I'd like to remind everyone from the press release that we issued the day before yesterday. We have established a COVID-19 dashboard specific to the Butte County Jail. We will update that on a daily basis with the exception of weekends. We want to be consistent with our partners in public health. You can access that dashboard by going to www.buttecounty.net/sheriffcorner/COVID-19. The bottom line is, folks, this is a serious situation in our community. No one wants to be in the position that we're in. The fact of the matter is, I think we at the Sheriff's Office, as well as our partners at the Butte County Public Health, as well as the other stakeholders involved, have really worked diligently to try to mitigate the spread. But we are not alone in the struggle. The fact is, everybody in the state of California is contending with this, and unfortunately, we now find ourselves on the monitoring list. I would ask that everybody take this seriously and do whatever we can to start to mitigate this, decrease the spread, so that we can safely go back to where we can open up schools and businesses and things. But it's a situation where we all have to pull together and work together. Now, I have another meeting that I have to attend at 10:30, so I have very limited time. I know that I wasn't supposed to take questions, but I'll take just a couple of questions. Hold on, Jerry, I got you. And then I will, I'll leave my PIO here for some additional. So, Jerry, what do you got?
Bearing in mind
Yeah.
that hindsight is perfect, 2020, do you or your office bear any responsibility, or would you have done something differently given what you know now in terms of how you handled your jail, a month ago, 2 months ago?
Sure. So that is a great question, Jerry, and I appreciate the answer, the opportunity to answer it. So the fact of the matter is, and you know this because you have been covering these stories from throughout the entire, from the beginning of the pandemic. Oh, they can't hear the question. So Jerry, they've asked me to repeat your question, so I'm just going to summarize it. So essentially, knowing what we know now, hindsight being 2020, is there anything that we would have done differently in the beginning to try to prevent this?
Yes.
Oh.
Yes.
Okay. And so the answer to the question is, I believe that given the facility that we have here in Butte County, the resources that we have in Butte County, and the ever-changing information with regard to the appropriate guidance and procedures, we did everything we could reasonably do under the circumstances. And I think that it's important to point out that we are by no means alone in this situation. The fact of the matter is, we followed the best practices and guidance as they were put out, and as they changed, we worked to adapt to those changes and implement those things. And the California Department of Corrections and Rehabilitation is massively suffering from an epidemic of COVID-19. An institution and an agency of that magnitude with those resources, if they are susceptible to this, then I would say that any small or medium-sized county jail would be, and we are by no means the only county jail who has to contend with this. This is pervasive throughout the entire community, and the population of the jail reflects the entire community. And so when you're going to have the spread in the community, you're very likely to see it in places like jails and assisted living and care facilities. And so as regrettable as it is, we have worked hard to try to mitigate this, but we are dealing with something that no one currently living has had to deal with. And I think that overall, we've had to adjust to a very, very dynamic and difficult situation. You had a question?
Yeah, now we can ask about this. How does it help to count cases in Butte County jail if some still in jail are from Butte County? So how does it affect the numbers in the report?
Okay, so I'm gonna say what I think I heard you say. How does it?
How do you count cases if some members in the jail are not from Butte County?
Oh, so how do I count if an inmate isn't a Butte County resident, but they are in Butte County? Why do we count those cases? How do we count those cases? Well, I count them as a member of the population of the Butte County Jail, and I would say that so long as they reside in the Butte County Jail, then that's how they would be counted. If an inmate lives outside of Butte County and they are released either by law or due to medical necessity, we coordinate with the Butte County Public Health Department to ensure that the Public Health Department in the jurisdiction where they live can take over and monitor the situation and provide active care. Okay? And I have time for one more.
Now that Butte County is on the watch list, is the Sheriff's Office going to take any extra measures to enforce the mask policy?
So last time we had a press conference, the CO, Sheriff McCracken, outlined the county's enforcement. And the fact of the matter is we have to have cooperation of the members of our community. There are not enough deputy sheriffs or police officers in Butte County to go around responding to people who aren't wearing masks, which is why we need people to take personal responsibility. And I understand that a lot of people don't like wearing masks. They don't want to wear masks. Maybe they don't believe that they're helpful. I don't like wearing a mask, but I do it because there is evidence to support that it does help reduce the spread. And if it's something that I can do to help my community and help those small businesses who are being negatively impacted get back up and running, then I'm going to do it. Where we think that law enforcement resources should be employed is obviously dealing with the day-to-day criminal activity that still goes on. But when an individual who is under an isolation order because they have tested positive doesn't abide by the health officer's order, we have worked very actively and cooperatively with public health to enforce those orders. I think that that's the appropriate use of law enforcement resources. Beyond that, like, there are other state agencies and code enforcement solutions to the individuals who haven't tested positive but won't wear a mask. And Jerry, I'm going to do one more.
Final question. Code enforcement, how aggressively will you pursue businesses that are remaining open in the event that the time passes and they're on the list in the state's control? So,
and Jerry's question was, how aggressive is code enforcement going to be with regard to those enforcing the order against businesses who remain open? And I'm sorry, I don't oversee code enforcement, and so I wouldn't feel comfortable speaking on their behalf. Okay, thank you, folks. I appreciate that. And
Good morning. My name is Mary Sakuma, and I am proud to serve as your Butte County Superintendent of Schools. With me today for the Q&A segment of this press briefing are my colleagues Doug Kalin, Superintendent of Biggs Unified School District, and Superintendent Kelly Staley of Chico Unified School District. First and foremost, we want to assure the community that educators around the county, in collaboration with Butte County Public Health, have been planning and are prepared to handle different scenarios for how student learning will take place this fall, dictated by current health circumstances. Butte County Office of Education, BCOE, and Butte County school districts and charter schools have prepared to offer family options for in-person learning models. However, on Friday, July 17th, Governor Newsom laid out his plan for schools across California to physically open or close as the 2021 school year approaches. This plan centers on local data and existing matrix to determine if our students and staff can return to classrooms for a new school year. We are not in a place that any of us wanted to be to start a new school year. The coronavirus pandemic has presented all of us with some of the most challenging times we have ever experienced. We acknowledge that this has been another period of fast-changing circumstances. Families may be feeling confused and overwhelmed by all the information that they've received this summer and by yet another last-minute shift. We acknowledge that the social emotional needs of our students continue to be a great concern due to the circumstances that the pandemic has created. District leaders have worked diligently and thoughtfully to plan and respond with information that changes seemingly daily. BCOE and local school districts had planned to move to full distance, BCOE and local school districts had planned to move to full-time distance learning if local health conditions dictated this. We're prepared for this scenario, and we are ready to act swiftly to ensure that students have equitable access not only to education, but also food and nutrition services. These services have continued through the summer at various locations through the county, and meals are available for free for anyone 18 and under, regardless of what school they attend, and no paperwork is required. We encourage families to continue to be proactive in reducing the risk of the spread of COVID-19 by not congregating at the meal sites and continuing to utilize social distancing and wearing face coverings. For this reason, these meals are designed to be grab and go, and meals will not be consumed on site. Once school officially begins, whether in a virtual or in-person format, depending on our circumstances in the coming weeks, regular daily meal service will be provided by school districts and charter schools. And for our smaller districts, BCOE will continue helping coordinate food distribution for our students. BCOE and Butte County Public Health will continue to support all of our schools with all of the available resources that we have as we move into distance learning, including guidance and professional development for teachers and collaboration to ensure that students receive meaningful and equitable opportunities to learn and succeed in online classrooms. When the time is right and public health conditions allow, every district's goal is to provide families with safe and feasible educational model options. In-person educational models include limited in-class opportunities for students to learn and thrive while using health practices and protocols to make school environments as safe as possible for students and staff. The ultimate goal for schools is a full return to the classroom, and we need your help in making this happen. Wash your hands for a minimum of 20 seconds. Sanitize your surroundings, maintain social distancing, and stay home even if you're not sick. We are once again asking for the community's help, and everyone can take these steps to help slow the spread of infection. School districts will send families more detailed information regarding the start of school dates and distance learning details in the coming days. It is crucial for families to keep their students engaged in whatever educational options we can provide to ensure that learning continues to occur. We understand that when our students and teachers can return to classrooms, school will not be a normal experience in our COVID reality. It will look, feel, and be different. However, we as an educational community have learned that we can count on each other when the times are tough. The Butte Schools community has learned to be resilient. We've learned to adapt to rapidly changing circumstances. Our unified goal is to ensure equitable access to education for all students while maintaining a safe and healthy environment for both staff and students. And we all look forward to our students' eventual return. Thank you.
Thank you to our speakers. We're going to go ahead and start the question and answer period, and we're going to start with Danette York, Director of Butte County Public Health. Are there any questions for Danette? Thank you.
Before I take the first question, I would like to just follow up on a question that was asked of Sheriff Honey, and I'm not sure who asked it, but about the cases for individuals that are in the jail that are not Butte County residents. They are counted as Butte County residents because they are currently living in Butte County. It would be the same for if a Butte County resident was arrested and placed in jail in another county and got COVID-19, they would be counted as that county's case, not Butte County. Yes, Jerry.
Yes, you mentioned 3 metrics. Do all 3 metrics have to be achieved in order to not go to the next level on Friday? And if that's the case, what are the chances? What's in all likelihood that those metrics will not be reached and we will go to the next stage, which requires the closing of these businesses indoors? What is the likelihood?
So the question is about the metrics that I spoke about earlier, and if all of them need to be reduced prior to if we were to have a chance of coming off of the list prior to Friday, correct?
Yes.
So the answer is, and I attempted to cover this in my speech, but so there's no established number. So there's 3 metrics, 4 if you include the testing number. The state did not establish whether or not if a county met 1 metric they would go on the monitoring list, or if they met all of them they would go on the monitoring list. That was not established. It was going to be and is considered on a case-by-case basis. In theory, if our cases go up, so do our hospital utilization. So in theory, if our cases go down, hospital utilization will also go down. It's a lag time, so it's delayed, but it should go down. To answer your second question, what is the likelihood that we could come off the list prior to our businesses having to close indoor operations? It is a possibility, but in my opinion, it is highly unlikely. I expect that we will remain on the monitoring list through tomorrow, which is Friday, and therefore on Saturday, those sectors will have to close indoor operations. Yes, Jerry?
And I have one final question. How aggressively do you think code enforcement should go toward these businesses if and when this next stage is reached?
So there, as the sheriff mentioned and the CAO mentioned last week, there is a plan in process for how to enforce, to make sure businesses comply. That process is not complete yet, but I believe it will be complete and spoken to in more detail at next week's press conference. So I would ask that we wait until then. Other questions? Okay, thank you.
Okay, now we have Mary Sakuma, the Superintendent of Schools in Butte County, as well as Kelly Staley, the Superintendent of Chico Unified School District, as well as Doug Kalin, Superintendent of Biggs Unified School District. I'm sorry. Does anybody have questions for the school?
I may as well. Hi, Mary.
Hey, Terry.
I just want to make sure I don't make a mistake, and so forgive me if you repeat the same thing. I just don't want to make a mistake. I'm trying to be diligent here. It appears as though there's going to begin online teaching, but if you're ultimately taken off that list, do you envision the schools being able to adapt quick enough to return to in-person teaching?
Well, so the question was, if there becomes an opportunity that schools can open by the county coming off the monitoring list, are the schools prepared to quickly adapt back to whatever model each individual district has adopted for their learning model for the fall? So I'm going to say just generally, yes, that will be true, but I also want to assure parents and communities that each district will develop a plan as to what that might look like, and let me be specific about that. There will be some districts who may choose to establish a minimum number of weeks that they will remain on distance learning to provide very consistent model for students and families that allow families to plan. So that may be a 6-week period or first trimester period, for example. But again, each district and charter leader will work with their individual boards and communities to determine exactly what that might look like.
What will the Office of Education be doing while we are in the remote education period until we come off the watch list? What will we be doing to figure out which students and areas do not have equitable access to internet resources, perhaps still need a laptop, things of that nature, to be able to work under remote education standards?
So, try to repeat your question. It's a bit of a lengthy one. So the question is, what will the Office of Education be working on during this time when we are in a distance learning model to ensure that students do have equitable access to the variety of modalities of learning? So we're already in process of, first of all, developing a robust program of support to all of our districts as our partners to explore exactly what the needs are for teachers to feel confident about delivering curriculum in this model. And I want to assure the community that this didn't just start this week. We've been working on this really since the spring to help develop expertise. So that's one piece. And then secondly, we continue to advocate statewide about this issue that's a big concern in certain parts of our community in regard to equitable access to robust internet services, which really are essential in order to provide in a virtual modality. We do have some districts who have the ability to offer other modalities, but I wouldn't want to go into any of those details without having that plan in front of me. Jerry?
Have you considered the possibility, like other businesses are permitted to do, by having 3 open sides of walls for proper ventilation? Have you thought about maybe having at least some of the classes taught outdoors, perhaps on some of the patios or in some of the quad areas of a campus? Is that something that would be considered so that you can still maintain the rules while also allowing what many parents believe is very important to have the engagement with their teachers?
Okay, so I'm going to ask my colleagues if you do have any specific information you'd like to share about whether you had discussion around outdoor education. But the first thing that I think is really important to make clear in regard to whether there have been plans created to teach school outside. And what I think is first and foremost really important for everyone to understand is that at this time, no in-person classes are permitted. So that is a hard and fast rule at this time. So, but at the time that we return, I know that our various districts have examined all different kinds of possibilities. One of the charter schools had announced that they would be using outdoor space, for example, that they happen to have on campus that they thought that they could adapt to such a model. But again, that would not be able to take place until such time as our county is off the monitoring list.
Thank you. I understand that. Thank you.
Thank you.
Thank you.
Okay, that concludes our press conference today. Thank you everyone for coming. We will be holding these weekly moving forward, and they will continue to be live streamed on Butte County Public Health's Facebook page. I'm sorry. Thank you very much for coming.